Hello, good evening. Bankole, good evening. All right, I see that some of us is still struggling to get our network sorted. So let me give us like 5 minutes. All right. Good evening. Welcome to our week 2 of online facilitation. In this week's lesson, week lesson, we'll be looking at module 2. And module 2 of NSC 512 has 6 units under it. It has 6 units, but today we'll be covering just 2 units out of the 6 units under module 2. And I would like to thank you for joining the class. And I want to say that I truly crave your participation. Please feel free to respond and interact, and let's interact together in the next few minutes of this class. So as I was saying that we are on week 2 and module 2. Last week, we covered module 1, which is basically the history of occupational health. And this week, we'll be looking at module 2, and I will be sharing my slide on module 2. I've said that we are looking at unit 1 and unit 2 of module 2, and module 2 is titled Occupational Health Problems, and I titled it, this is part A. It's divided into part A, part B, and part C. So for the part A of it, we are covering unit 2, and unit 1, and it's titled An Overview of Occupational Health Problems as well as Occupational Diseases. So, but before we dive deep into the interaction for today, let's see the expected learning outcomes or learning objectives or learning goals for unit 1 and unit 2 of this module. Unit 1 and Unit 2 learning objective says that at the end of the facilitation today, learners should be able to explain the meaning of occupational health problems and diseases, list the different types of occupational health problems, and describe the types of occupational diseases you know with predisposing factors. Learners should also be able to explain how working conditions contribute to employees' increased risk for health problems. Explain the preventive measures to health problems, as well as be able to discuss the management of the common health problems in the work environment and describe the prevention and control of occupational health. That is the learning objective, what you are expected to know or to be able to defend or to be able to write. Or if you are asked anytime, you should be able to say them. When we talk of overview of occupational health, it's simply we want to know what is occupational health and what is occupational health problem. So when you say occupational health problem, what comes to your mind, Bankole? Are you able to hear me? Please kindly unmute yourself, Bankole. Tell us what you understand by occupational health problems. We are not hearing you. We are not hearing you. Unmute yourself. Look at the button. Okay, fine. We can hear you now.
That's right.
Yes.
I say occupational health problem can be related to those hazards that someone is being exposed to, like maybe contagious diseases, maybe an accident while using a machine in the course of discharging their duty while working.
Excellent, excellent, yes. As Bankole rightly said, that occupational health problems is any form of accident or disease or hazard that you sustain from your place of work. So when you sustain any form of injury, disease, accident, hazard, while you are doing your job, it is known as occupational health. And of course, we have different types of common occupational health problems. Who would like to share with us the different types of common occupational health problems that we are aware of? Can one of the students share his or her thoughts on that? Remember, I said this is a student-centered learning, and as much as possible, to facilitate and not to do a lecturing work here. So kindly let's interact together. It makes it more fun when you are responding, when you are interacting with me, and you don't leave me to do the talking alone. Okay? Yeah. So, Anna, you want to share your thoughts on different types of occupational health problems that you are aware of?
Yes, ma'am.
Okay.
There are so many types of occupational health, like you be contacting another disease. Say if you are treating a patient, then maybe the patient has tuberculosis, you now contact that tuberculosis from the patient. Or we talk of, yes, lung diseases like asthma too, then traumatic death, and we have, say, getting HIV from a patient as a result of treating the patient who has HIV.
Okay. Okay. Thank you. Good try. Yeah. We also have noise-induced hearing loss. It's a form of occupational health for those who work in mining industry. You see, because for some who are not adhering to the use of occupational health safety gadgets, at the end of their working experience, if they develop noise-induced hearing loss, that is an occupational health problem because they contracted that ailment from their workplace while doing their job. We also have musculoskeletal injury. So and this, for those that are nurses, can relate to this. And no wonder the nursing profession taught us how to lift patients and how to bend, because at the end of the day, after your shift, you don't want to go back home and not be useful to yourself, having pain, back pain, neck pain, and so on. So these are different forms of occupational health that we have. Any question? Okay, if there is no question, another point I want us to discuss is occupational health problem in industry. When you say occupational health problem in industry, what do you understand by that? Of course, we know that majority of the people working in industry face various occupational health problems that affect their productivity and even their lifespan. So in the context of industry, what are these problems? How do you group this problem?
Like, Bankole speaking, ma. Like people working in cement factory industry, they are used to exposure, contamination of the air, in which the chemicals that they are using are being released into the air, and at the end of the day, they end up having problem with their respiratory system. Some develop asthma, some even develop cancer of the lungs or any serious respiratory disorder at the end of the day.
Yeah, you are right. You are right. And thank you for the good try. You see that we have both social and environmental pollution. That is a pollution. Of course, we have different types of pollution. We have air pollution, we have noise pollution, we have chemical pollution. And that, the example you've given now, is classified under chemical pollution. So we want to look at, it's important to understand these different types of pollution. When we say social and environmental pollution, what comes to our minds? Social and environmental pollution. Of course, for those who live in the city, you should be able to relate to this. Social and environmental pollution. I hope you are all able to see my screen. Bankole, are you able to see the screen? Anna, can you see the screen?
Yes, ma'am.
Okay.
Yes, ma'am.
So let's flow. Let's flow. Social and environmental pollution. What do you understand? Are there more people?
Like,
okay, continue.
Like what is written on the screen is just like migration of people from a less populated area to already condensed area, fully populated, thereby now causing overcrowding, easily spread of diseases, and then more of environmental pollution will now result from such acts.
Excellent, excellent. you know all this facts. You see, a lot of people, because of search of job, for so many reasons, people are migrating. And you see a lot of people are migrating from the rural area to the urban area, causing environmental pollution, causing overcrowdedness in that city, as you rightly said, which is not good for the health of the people and causing occupational health problem, because many wants to work in the industry now, many wants to live in the city now, and so on and so forth. So we also have air pollution. You've mentioned it earlier on. You said that is a contamination of the air. When you are breathing in, when an individual who is at work, the air is not pure. So the person is breathing in air that has chemical, that has pollution. So at the end of the day, because of the environment you find yourself that you're working, the air you're breathing in is affecting your health. We also mentioned noise pollution, and we've said it. What are what class of people do you think can have noise pollution problem of occupational health?
Like people working in quarry where they are blasting rocks.
Yeah, yeah, yeah. What about people working in the grinding? They call it what? There is this group of people that they grind, that work in the sawmill. Yeah,
Millers.
people who work in sawmill as well. They use heavy machine that makes noise. And those commercial people that also helps us to grind large quantity of maybe our milli meal or um, cassava meal, maize meal, yam meals, and so on, all the meals, all the flour. So they can also dispose to, because that is their job now. So they can have noise pollution, occupational health problem, and traumatic injury. So these people in different place of work are exposed to either mention, Anna mentioned earlier on, you treat a patient who is HIV positive, you carelessly pick yourself. That's an injury that you have caused to yourself. So it will not only bleed, but you can be infected with that disease. People work with machine in industry. Maybe they are on medication or they are tired, they didn't get their break. They're still operating the machine. Before they knew it, their hand got chopped off. So these are different things. People who are working in construction company, sometimes they miss their steps while climbing, they fall and sustain trauma, laceration, and so on and so forth, are different health problems that workers face, especially where protective measures are not enforced and monitored. So would you say that is it enough for an employee to provide a protective gadget without monitoring whether it's being used or not? What do you think? Of course, it is not ideal alone. That is why at workplaces, they have what we know as supervisors. Supervisors goes around to make sure that workers are doing what they are supposed to do. They are wearing what they are supposed to do. They are where they are supposed to be. Otherwise, human tendency wants to do what pleases them. But to avoid your workers sustaining or exposing his or herself unnecessarily to occupational health problem, you don't just provide the safety protective gadgets or equipment, but you also monitor the use. So that takes us to the factors that contribute to health problems. What are these factors that contribute to health problems of workers? What are they? Esther. Esther, what are the factors that contribute to the health problems of workers? Okay, I can see Esther is not there. Okay, Anna, you want to share with us?
We have the biophysical factors as psychological factors.
Yes. Okay. We also have social factors as well as psychological factors. So we also have behavioral factors. And when we say behavioral factor, this is a very important factor. You see, many employees within and outside the work setting can significantly influence their employees' health. How can they influence it? You see, the lifestyle of every individual differs. We have people that their lifestyle behavior, they have poor resting lifestyle behavior. Yes, some they don't rest, even though they work. If nature will permit them, they can work 24 hours without rest. And such a person is working in an industry that operates machine. The employers has to be on guard for such a person, has to promote the importance of rest to his workers so that they can know that it's very important that after work you rest, and failure to do this or to imbibe this lifestyle of resting can affect your health. Either you are dosing at the time of operation of the machine and you get injured. Not only poor resting, some don't exercise their body. Some have the lifestyle of smoking, some have the lifestyle of taking drugs, alcohol, and even some have a lifestyle of not taking good nutrition that influence their health. All this, but the employer can actually help us to become better, help workers to become better or imbibe a good behavior that will enhance their health and promote their productivity. So we know that good rest and exercise provides physical and psychological relaxation, as well as alertness and relieve muscle tension. So when you are relaxed, you'll be able to do and focus on what you have to do. So we've seen that the biological factors, the psychological factors, the social factors, and behavioral factors are the four main factors that contribute to the health that prevents the health problems of workers. So what are the preventive measures to occupational health problems? How do you, as a nurse, working as occupational health nurse in any organization, help the employees to take measures that will prevent occupational health problems? What and what would you do, or would you encourage? Let's share our thoughts.
Firstly, Bankole speaking, ma'am. For any person to undertake any employment, the first thing they should do is to do medical checkup to see if their health, if their state of health to be able to permit them to undergo such kind of work. Like somebody with sickle cell, that they are fragile, they always fall sick, and the person now wants to engage in any work that's more related to cold stuff, you will know that this person is not fit for this type of work.
Yeah, thank you very much. So we've seen that pre-employment medical medication is very important. So as a nurse, you want to know, have a baseline data of the employees of a company that you are working, so as to be able to advise the management that no, the job description you want to give to this person will impair or will further affect this person's health, considering that this person has this underlying problem. And let's assume now the person has a good medical report that comes. At what time, how can you help this person? And the person is working maybe in a factory like cement industry, or in a factory, or in an industry where they produce chemicals, or in an industry where it's more of lifting. So how often what measure would you take as the person is progressively doing their work? Apart from the pre-employment medical examination, what other examinations would you recommend? Maybe after 6 months of work, maybe every one year. Of course, you want to look at periodical medical examination. It depends on the job description of the person. Some can have it every 3 months. Some can have it every 6 months. Some can have it once in a year. And the reason for these measures that you are taking, you want to be sure that the job the person is doing is not predisposing him to any health hazard. Because if at the beginning of the work, this person is not having high blood pressure, and after 6 months of working, the person suddenly developed high blood pressure, you want to find out what is causing it. You want to do some investigation. Where is the person working? Is the person running a shift without rest? Is the person running shift or day? Or is the person doing overtime? You want to look into the social and the psychological and the behavioral factor of the person, so as to know whether you advise the management to move the person from where the person is currently being placed to another session that will be less of stress to the person. Because at the end of the day, you wouldn't want someone to be retired and be spending money on his health. So we've looked at occupational health problems. Now occupational health disease. What is occupational health disease? What is occupational health disease? Class, what is occupational health disease? What do you understand by occupational health disease? Are we still in class?
Yes, ma'am.
Good.
Ma.
So what is occupational health disease? Who wants to share his or her thoughts on that? Anna.
Ma, occupational health diseases are those diseases we contact as a result of our exposure to some, say, chemicals in our place of work, like those that work in
Okay. Okay, not only chemicals.
industry.
It's not only chemical. Are you a nurse or a public health officer?
Those chemicals, maybe they can dust, maybe in a ma.
Anna, are you a nurse or a public health or environmental?
I'm a nurse.
Okay. As nurses, don't we also get, we also?
Yes, we do. We do. That is why I mentioned HIV the other time, that as a result of you treating a patient with HIV, when you mistakenly prick yourself with a needle that you've used on that patient, you will now get be infected with HIV.
Okay. So we've seen that it is not only physical. You know that our work sometimes can give us stress, where you have to manage, maybe you are just two in a ward and you have like how many bedded ward, maybe 30 bedded ward. And that alone can put mental stress for you. So occupational health disease is not limited to physical. It could also be mental. It could also be social. Imagine working with a supervisor that do not like you. Everything you do, she always complain. And imagine you are in a world that you are not interacting, you're not having interpersonal relationship with your colleague, you're a low ranger. So when you talk of occupational health disease, it cut across all the spheres of our life, the physical, the mental, and the social well-being. So where either of these three is compromised, there is occupational disease. And because it is a situation at work. And we also have occupational, different types or different classification of occupational health disease. What are they? Don't tell me hypertension, don't tell me tuberculosis, pneumonia. Classification. Of course, we know when we talk of respiratory system, we have a lot of diseases, a lot of ailments that comes under respiratory disease. So classify it to me according to the system. So
upper respiratory
disease
and the lower respiratory disease.
Okay.
By
when
the
you say
wait,
Bankole, when you say upper respiratory and lower respiratory disease, is that what I heard? Is that what you said?
Yes. Yes, ma'am.
Okay. So what is one word? Going back to your anatomy and physiology, what one word we can capture that? That is a system. What system? One system capture those two together.
That's the respiratory system disease.
Excellent. Yes. Yes. Correct. The respiratory system, that is one. Another point. Another point.
The digestive
The cardiovascular.
The cardiovascular system. Yes, that's another one. Another one.
the integumentary system. I know how to participate though.
Okay, yes. We have the gastrointestinal system, the urinary system, the dermatological system, and the musculoskeletal system. So when you say occupational disease, it is classified under each of these systems. As we know that each of the systems have a lot of ailments that can be under them, and she mentioned some of them earlier when you talk of the TB. Yes. So we've seen, and we want to look at the predisposing factor to occupational disease. What are the things that can predispose employees to occupational disease? Let's mention them. Factors predisposing employees to occupational diseases. Antonia.
Where there is lack of personal and environmental hygiene, the employees are liable to be exposed to various types of diseases at their workplace.
Okay. Another point, poor personal hygiene. Not only personal, even environmental hygiene. Yes, very important. It can predispose where an individual is working in an environment that is polluted. So, another point.
Even individual that is not feeding fine, that their nutritional status is poor, they will have low immunity and they can be easily predisposed to contagious disease around them.
Yes, that's another good point. And that is why when you work in a standard industry or organization, they normally have canteen, a restaurant that is situated in the compound, in the organization, in the institution, because they understand the importance of the nutrition, the immunity, and the health of their workers to the production or to productivity that they give. So they don't joke at all with the nutrition of their employees. So it's important, but many of the institutions that we work with do not have that facility. And when you and I become an employer, let's remember to factor that when we are putting up our industries and our organization, so that we don't want to predispose our employees to occupational disease. Another thing that we want to mention is lack of periodic medical investigation. So when employees are not allowed to do periodic medical investigations, they wouldn't know whether their health is deteriorating or not. And non-compliance use of safety material. Very important, very important. I once worked in an industry as an occupational health before I moved into academics. And I like the organization of that industry. You see, the security will not allow you to pass the gates if you are not wearing your safety boot. You cannot come into the industry or into the institution with an open shoe. Whether female or male, everyone put on a safety boot. So that is one. So, and when you enter, you see, you pass different stages or different security. There, for those who are working in production, you have to be well dressed before you are allowed into the production room, which is very, very important. It's helping not only the employers, but it's also helping the employees. Because when your employees are affected, it also affects you, because it reduces it reduces production for that day, which is a loss. What are the ways to discover occupational diseases? When you say occupational, how do you detect occupational disease in any industry? We see that it can be detected via biological monitoring, epidemiological method, and environmental method. And when you say biological monitoring, what do you understand by biological monitoring? Like we earlier mentioned, when there is a pre and periodic medical examination, which helps to identify potential health problems that employee is being exposed to, and you want to take prompt action to prevent it. So we are gradually getting to the end of the class. When we now say environmental methods, what do you understand by environmental methods? Environmental ways of discovering occupational disease. I just explained biological method now. Okay, when you say environmental method, it simply helps you to detect hazard in the workplace, that is in the immediate environment of the employees. You want to see what are the things, what are the hazards that is within the environment. You want to identify it early, and you want to reduce, in order to reduce the adverse effects and prevent complications of it. What about epidemiological method? When you say epidemiological method, it's just a way of studying the determinant and the distribution of diseases among workers. Maybe a worker comes down with chickenpox, or tuberculosis. So you want to see, okay, how many of the workers have this ailment? What is the determinant of it? So all these things are ways of discovering occupational diseases. And the last slide, the last point I want us to look at is strategies for prevention of occupational disease. There are strategies that is taken in order to prevent occupational health disease. One is work-related disease are mostly irreversible, like someone that is dosing while operating machine. And the person accidentally put his hand and the hand gets cut off. You can't reverse it. Even though your employer can pay you and take care of your health bills and hospital bills, I mean, and give you rest and compensate you, but they cannot replace your fingers or your arm or your leg. So therefore, priority should be given to preventive measure to reduce and prevent occupational related problems. And what are the ways or the measures you want to use to prevent it? One, elimination of hazardous agents in the work environment. Once you see any hazardous agent, you must, as a matter of fact, look out for it as an occupational health nurse. You look out for any hazardous agents and you eliminate it. You also want to look for, do a suitable training, constant seminar, workshop, training for all workers, reminding them, even though you've told them at the beginning of their job, but you want to, at good interval, train them to remind them of the importance of their health and not be negligent on duty, time to rest, and so on, good behavioral lifestyle. You also want to provide administrative control, provision of personal protective equipment, maintenance of maintenance system to track hazard and correct it once it is seen. And lastly, you want to take emergency preparation once there is an emergency. In conclusion, every occupation has its own risk and hazard associated with it. For that reason, the only way out is strict compliance to preventive measures, which could be the proper use of safety devices, avoidance of unsafe practices, frequent medical assessments, and early treatment of identified problems. Thank you for attending today's class and listening. You are welcome to ask your question. Question and contribution. Questions and contributions. Okay, if there is no question, no contribution, this is where we will end it today. And I want to say thank you for those of you who managed to attend class. And we'll see you next week, same time, same day. Have a good evening. Bye.